And it's not just scammers you need to watch out for this summer, especially if you want some time in the great outdoors.
Yeah, we were talking about mosquitoes and midges the other week, but there's another little nasty parasite to look out for. That's right, isn't it, Dr. Poonam?
Yes.
Who is this? What is this?
This is ticks,
Oh.
and they're a right pest. And, you know, a recent study, actually, a survey in Scotland showed that 54% of people in Scotland didn't actually know what ticks were and what to do if you got bitten. So we can see on the picture there, ticks are like spidery little creatures. And we see them typically in prevalence from March to October time, and they live in kind of woodland areas, meadows, parks, anywhere where there's long grass. And they're sneaky wee things in that they don't jump and they don't fly. They cling on to stems of grass and they wait for you to brush past them, and then they cling onto the skin. They burrow their head in and essentially they're sucking your blood. I know, they're horrible. But prevention is everything. And I think that the importance is of raising awareness because, you know, although it's uncommon, it can go on to cause more serious symptoms, which we'll come on to. So in terms of prevention, the things that you can do if you're planning a walk in a woodland area, you know, make sure that you're covering any exposed skin, especially the legs, so wear long trousers, put your socks over your trousers.
It's not a great look, is it?
Not,
but it's
I know
worth
it's not fashionable, it's not trendy, but you know what?
It's not time and a place.
Exactly.
Okay.
You want to be wearing your insect repellent, which we've spoken about before, walk on footpaths, that kind of thing. And the importance is that when you get back indoors, you want to check all skin area of yourself, your kids and your pets to see if you've been bitten.
Katie's been in touch. She says, we went to a remote island in Scotland for a picnic and we started getting literally swarmed by ticks. It's so important for people to know how to remove them properly and safely, but how do you do it?
Absolutely. And again, sneaky in the way that you don't often feel that you've been bitten by a tick. So that's why exposing and looking carefully at the skin is important. And then if you do see that there's a wee tick, remember the head is burrowed into the skin, so you want to get that out. So using fine tweezers, which you can see on the picture there. If you don't have that, you can get little tick removing tools from a local vet or a pharmacy. Essentially, you want to get as close to the skin as possible and you want to remove that head. You're not trying to squeeze it or twist it. And if you are squeamish and you feel like you can't, maybe just popping along to your local pharmacy, Miners or your GP, you can get it removed that way. Once that's done, you want to clean the area with soapy water, put some antiseptic on top, and over the next few days, just keep an eye on it. If it starts to get red, tender, swollen, or you develop a rash, you need to see your GP.
And what will that rash look like?
Yeah, so the reason that we care so much about tick bites is that although it's very uncommon, they can carry a bacteria that causes Lyme disease. Now, Lyme disease, if caught very early, we can treat it, but long-term can cause symptoms and more serious kind of disease. So essentially, people can get a rash that have Lyme disease. Not everyone gets it, and it can look very different on different skin tones. And it is a circular, as you can see, there's a circular round rash with a blotchy red bit in the middle. Often looks like a bullseye on a dartboard. And you can see it on, that's it, on darker skin tone. Now, a third of people with Lyme disease won't get the rash. But if you do start to get flu-like symptoms, any fever, achy joints, anything like that, then you would see your GP. We can do some blood tests, but we would immediately start you on some antibiotics. But if left untreated over a few days, and even weeks actually, it can go on to cause more serious things like memory problems, nerve-type symptoms like pins and needles and numbness, and even heart problems.
We're getting so many messages through as you're talking about this morning. I'm just seeing that Eleanor here says her sister recently had a tick bite when in Germany. She's hoping it's not caused any harm. Is there anything she can do now? Are there any long-term complications to this?
So I do want to reassure everyone that the vast majority of people that get tick bites, you're absolutely fine and you get no complications. But it is, although uncommon, with Lyme disease, if left untreated, and some people can go on to cause something called post-infective Lyme disease. Now, this can be very debilitating and can cause symptoms that almost mimic fibromyalgia, chronic fatigue syndrome, and also long COVID, where people can have severe crippling fatigue, joint pains, chronic pain-type issues. And although there's no cure for it, a lot of supportive treatment is available. But this is why we're speaking about it. This is why we're raising awareness, so you know what to do if you get it.
Yeah.
Well worth putting the socks over the trousers on a walk then.
Absolutely.
Yeah. Prevention is the best cure.
Yes.
Thank you very much, Poonam. Well, still...